Hi students, I am Dr. Arati Dave Lalchandani and today we will talk about a very important chapter on palpitations. So I will discuss in detail about palpitations, the etiology, the perception of palpitations, and of course what is palpitation. Topic today is palpitations. Palpitation means an awareness of heartbeat. Palpitation means you are aware of your heartbeat. In Hindi it is dhadkan. Ghabrahat is nervousness in English. Ghabrahat is nervousness. Uljhan is restlessness. So these are the terms which you use. So you can put down as such. अगर तुमने लिख दिया complaints of uljhan or ghabrahat, so you can put. But anxiety is चिंता. Anxiety is परेशान होना, चिंता करना. That is anxiety. But घबराहट is nervousness. You are nervous about it. And agitated, irritated, all that is restlessness. उलझन करना is agitation maybe. Palpitations is धड़कन, isn't it? Now धड़कन may be a good thing, maybe a bad thing. अच्छी खबर सुनते हैं, धड़कन होता है, यू फील हैप्पी, दिल धक धक कर रहा है. कितने गाने बन गए धड़कन के ऊपर. गाना बताओ धड़कन पे, बताओ धड़कन का गाना बताओ.
दिल धड़कने दो.
ये कौन सा गाना है, दिल धड़कने दो? कौन? प्रियंका चोपड़ा. दिल धड़कने दो
मूवी का नाम ही है.
तो मूवी का नाम नहीं, गाना भी है.
सॉन्ग भी है.
अच्छा, दिल धड़कने दो. और कौन सा गाना? धड़कन का तो I'll tell you about धड़कन. बताओ और बताओ. एक वो गाना है, दिल धड़क धड़क के कह रहा है आ भी जा. सो इट इज एंटिसिपेशन, इमोशनल. इमोशन से बहुत धड़कन जुड़ा हुआ है. और क्या है? धक धक करने लगा. Isn't it? मेरा जिया धड़कने लगा. So this is another song. Wherever dhadkan is related with emotion also, good emotion also, and bad emotion also. कि मेरे को बहुत घबराहट हो रही है, धड़क रहा है, दिल बहुत धड़क रहा है, कुछ होने वाला है, कुछ ऐसा हो जाएगा वैसा. So it can be a good emotion, bad emotion. So commonest cause of palpitations is an emotional excitement or कोई बैड न्यूज़ आ जाए, गुड न्यूज़, एंटिसिपेशन, है ना. कि कई गानों में होगा जरूर ऐसा गाना जैसे समथिंग गुड इज हैपन, कोई आने वाला है, दिल धड़क रहा है, समथिंग. हाँ, तो लाइक दैट मे बी. सो I also don't remember these songs, but there are a lot of songs on dhadkan. So it can be emotional. Then it can be, and this kind of palpitation, where it is felt, this kind of palpitation is felt mostly in the epigastrium. And this kind of palpitation is related with tachycardia, with increased heart rate, but is not related with any arrhythmia. The heart rate will be regular. And it can result in a pounding which you can feel. अरे देखो देखो धड़कन हो रहा है. So what they mean is that it can be felt. Maybe it can be felt also. It may be related with an increased contraction. But usually this is a perception may not be related with increase in heart rate or an increase in force of contraction. May not be. So this is one cause of palpitation is emotional excitement. So I'm not enjoying very much writing on the board. So it may be an emotional or functional cause. Functional. So this may be the cause. Then in this, another now heading under this is, it may be due to a consumption of say tea, coffee, simply a tachycardia, but tea, coffee, tobacco and other stimulants, they can give rise to caffeine, nicotine or other substances in any form. They can give rise to tachycardia as well as arrhythmia. It can also give rise to ventricular or atrial ectopics. So this can be due to either as tachycardia or ventricular or atrial ectopics, extra beats. So these are the common causes, and then you can get palpitation, like for example, lack of sleep, excess sleep, lack of sleep, insomnia, or excess sleep when you get up from, you have slept too much and you get up with lot of anxiety. अरे लेट हो गया, क्लास के लिए लेट हो गया. When you get up, you can get palpitation. It's very common. When you get up, then palpitation very common. Either you have not been able to sleep or you slept more. With students, it's the second one. You sleep more. देर से उठते हैं, घबराहट से एकदम घबरा के भागते हैं. And then, of course, it can even lead to a heart disease also. And lot of anxiety. If you force yourself to be anxious, टाइम से नहीं उठोगे, टाइम से नहीं कहीं पहुंचोगे, समय से काम नहीं करोगे, या कुछ छोड़ के रखोगे, पोस्टपोन करोगे, प्रोक्रेस्टिनेट करोगे. प्रोक्रेस्टिनेशन, all these things, don't do a thing well, efficient नहीं हो, you can't do things fast, you don't concentrate, you don't do appropriate things at the appropriate time. हर चीज़ का टाइम होता है. अगर एंजॉय भी कर रहे हैं, टोटली एंजॉय करो विदाउट एनी टेंशन. इफ यू वांट टू एंजॉय एंड इफ यू केप्ट रिजर्व से हाफ एन आवर एंड 1 hour एंड गोइंग टू जस्ट एंजॉय, देन यू स्टार्ट थिंकिंग अबाउट वर्क. काम के टाइम एंजॉयमेंट का सोचने लगते हो. इफ यू डू दैट, दोनों टाइम टेंशन एंड यू कांट एंजॉय प्रॉपर्ली, you cannot work properly. So you have to allocate the time, stick to it, do it wholeheartedly, give your 100% to it, whatever you are doing, whether it is a pleasure or whether it is work. But I tell you, I have mentioned in the How to Study book also, that for medicos, all the pleasure, all the enjoyment, all the happiness is in studies. जितना पढ़ोगे उतनी खुशी मिलेगी, उतना तुम्हारा entertainment होगा. पढ़ाई entertainment है. पढ़ाई whatever gives rise to guilt conscious होगा. तुम घूमोगे, मूवी देखोगे, कुछ भी करोगे, ये मोबाइल को यूज़ करोगे कुछ और भी एंटरटेनमेंट के लिए, तो ये मोबाइल को भी यूज़ करो फॉर स्टडीज, फॉर एनहांसिंग योर नॉलेज एंड गैदरिंग नॉलेज. बिकॉज medicine is so vast that you cannot know all, but you can at least utilize your time properly, and at least a little relevant things you can imbibe, and a basic knowledge you can have about everything. And at the most, just try to get a superficial knowledge about everything, don't go deep into anything, because you can't do that. Just you must know a little about everything, but don't leave anything. At least a little about everything you must know. So again, now lack of sleep can give rise to palpitations. So palpitations is a perception of heartbeat, awareness of heartbeat. That's the definition. And you know, when you are aware of heartbeat, when it is racing fast, that is, it is a tachycardia. So you get aware when it is a tachycardia, fast heart rate, and when, so that is a tachycardia. Now when you get, I'll be taking chapters on ECG, then you will understand this better. So when there are missed beats. Missed beats means one beat is missed because there was an extra beat initially. So heart is beating like this. If there is an extra beat, then the heart does not have blood, nor is it ready to accept another contraction, another stimulus. It becomes refractory for some time and not even having volume. So then there will be a missed beat. And then whenever there is extra beat, this is extra beat, early beat, called ectopic, extrasystole, ectopic beat, extrasystole, and therefore there will be a missed beat. One beat which should have come maybe here will not come. So there is a missed beat. So whenever there is a missed beat or extra beat, you are aware. Because जैसे एक सड़क के किनारे एक आदमी रहता था, वो सड़क बन रही थी, महीनों से बन रही थी, जैसे यहाँ बन रही है ना पनकी की सड़क, और ये नारायणा आनी की सड़क सालों से बन रही है, आज तक बनी नहीं। उसी तरह वो बनते रहती थी सड़क, आवाज़ होती थी मशीनों की, घर 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 रात को। तो वो घर पहुँचता था थका हुआ, आराम से सो जाता था, आवाज़ होती रहती थी। रात भर सड़क बनती थी, सवेरे काम बंद हो जाता था बिकॉज ट्रैफिक आता है। सवेरे जैसे ही काम बंद हो जाता था, आवाज़ वो उड़ जाता था, उसकी नींद खुल जाती थी, 6 बजे बंद हुआ तो रोज जब आवाज़ बंद हो गई तो उसकी नींद खुलती थी, आवाज़ होती थी तो आराम से सोता था। ऐसे कोई हो सकता है रात में सो रहा हो और सुबह सड़क बनने लगी, जैसे हमारे कानपुर में होता है, रात भर वो भी सो जाते हैं सड़क बनाने वाले, फिर वो सुबह जब हमें ट्रैफिक में जाना होता है सारे उठ के आ जाते हैं सड़क बनाने के लिए, और हम लोग बोलते हैं इधर जाओ उधर जाओ। तो सवेरे घर घर आई होगी आपकी, सवेरे नींद खुल जाती है, शोर होने लगेगा। सो मिसबीट कैन ऑल्सो गिव राइज टू अवेयरनेस। स्लो हार्ट रेट कैन ऑल्सो गिव राइज टू ब्रेडिकार्डिया, कैन ऑल्सो रिजल्ट इन पैल्पिटेशंस। Bradycardia, slow heartbeat, because slow heartbeat may be a powerful heartbeat. If there is left ventricular hypertrophy, as in aortic stenosis or hypertension, there can again be awareness of heartbeat. Palpitations, so this is another cause of palpitations. And arrhythmia of various types. Now in atrial fibrillation, now this is functional causes, tea, coffee, etc. Then tachycardia, missed beat, bradycardia, slow heartbeat. Then there can be irregular heartbeats, can also give rise to palpitations. So irregular heartbeats, you can tell the patient to tap on the table or tap, or if he can emulate it by producing sounds, then he can tell you what kind of arrhythmia he is having. Now supposing he says, I am having palpitation like this, lub dub 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 lub dub 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 lub dub dub dub. What is this? Lub dub dub. Yes, but what arrhythmia? Atrial fibrillation. Completely irregularly irregular. He can feel like this. Lub dub 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 dub, and no regularity. He can feel it. So this is atrial fibrillation. Irregularly irregular palpitation. Regularly irregular. This is irregularly irregular. Now regularly irregular. This will be ventricular ectopics. Now regularly lub dub dub dub, lub dub dub dub, trigemini, for example. Lub dub dub dub, lub dub, lub dub dub, lub dub dub, lub dub dub, or after every 6, lub dub lub dub lub dub lub dub drup, missed, lub dub dub lub dub drup. Lub dub 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 dub, like 6, 5. It can be regularly irregular. So it can be ventricular ectopics. Same atrial ectopic, usually they cannot feel. Atrial extracerebrally cannot be felt. Ventricular can be, because ventricular is a powerful ventricle, and once there is a missed beat, the next has more blood to pump in more diastole. Diastole, the ventricle gets filled with blood. More blood to eject, so more powerful beat. So it can be bradycardia, tachycardia, lub dub lub dub lub dub lub dub lub dub, bradycardia, lub dub like that. Missed beat, I told you, lub dub dub like that. Bigemini, trigemini, quadrigemini, or maybe after 10, then maybe after 4, but still it will be regularly irregular. So these are the kinds of arrhythmia which you can detect, and then it may be just very powerful beat. For example, in aortic regurgitation, what happens in aortic regurgitation? The blood the blood regurgitates back into the left ventricle from the aorta with every beat in systole. Now in systole, the blood is pushed forward. A certain volume, a fraction of this blood comes back into the left ventricle. It regurgitates back into the left ventricle, increasing the volume. Now it gets blood from the mitral valve in diastole. And then in the next systole, it pumps blood forward. But again in diastole, the regurg occurs and blood accumulates here, comes here to the ventricle from the mitral valve and from the aorta. This is a regurgitant blood and this is a normal flow. So this will give rise to palpitations, increased volume. And of course, because gradually the left ventricle may hypertrophy, and then it may hypertrophy only up to a certain extent, but more commonly it will dilate, start dilating, it will thin out because of the increased volume and force of contraction which it has to endure. So it can endure for a certain time and then it will fail. It will thin out and it will fail. The same thing happens in mitral regurgitation. What happens in mitral regurgitation? Left ventricle is getting blood from the, LA to LV, from LA to LV in diastole. It's getting blood. When this is in diastole relaxation, it takes in blood from the LA, and aortic valve is closed. Yes. So it will take, if I'm wrong, just correct me, because sometimes, while speaking, I may be wrong, but you have to correct me. Be very alert. Be very alert. So in diastole, the blood comes here. And in the next systole, what does it do? This valve will close, aorta will open, aortic valve, and this bicuspid, this mitral valve has 2 cusps, tricuspid valve has 3 cusps, aorta has 3 cusps. A bicuspid aortic valve is a congenitally abnormal valve and has a less life. It will become incompetent very fast. So through this aortic valve, it will go, the blood will be ejected in systole. This will open, and in systole, mitral valve will close. Supposing mitral valve is incompetent, there will be mitral regurg. Now you can't see, no? So you can just stand up whenever you can't see. So mitral valve will close, but if it is incompetent, it will not close properly. And when the left ventricle contracts and generates pressure, then with a pressure of about 120-130 millimeter, blood will be ejected into the aorta, the valve is open. But if this is incompetent, blood with this big force, 120 millimeter, some of it will go through the incompetent valve back into the left atrium. And then what happens? In the next beat, left atrium is having increased pressure, more blood. So after this mitral regurgitation, again more blood will come into LV in diastole, next diastole. So this will be dealing with an increased volume and increased pressure. So once either the volume or pressure or both, they are high in the pumping chambers of the heart, which are the right ventricle and the left ventricle, then what happens? You feel palpitations. Even in pulmonary hypertension, you can feel palpitation. In cor pulmonale, patients of asthma, chronic asthma, emphysema, COPD, chronic obstructive lung disease, once they have right ventricular hypertrophy, cor pulmonale, even they can feel these palpitations. So palpitations can be due to an awareness of heartbeat without actual tachycardia, without any damage to the heart, without any organic changes in the heart. It can be simply a functional awareness. For example, in emotional upset, excitement, it can be there, or lack of sleep, or you are very tired, or after running, after activity, after exercise, you need more blood, you need more output, your brain needs more blood, and your muscles, active muscles, they need more blood. So all the blood is diverted to the muscles, and you need extra blood. For the brain also needs adequate blood, so your heart will pump faster, more powerfully, more rapidly. So then you will be aware of palpitations in all these conditions. So it can be due to this, it can be due to irregular heart rate, but there is a hypertrophy, there is more blood, there is a dilatation of heart, so you can get a palpitation. Or the heartbeats are irregular, there is arrhythmia, there is a missed beat, there are extra beats. There is in regurgitant lesions, more common in regurgitant lesions, you can get palpitations. Of course, you can get palpitations in stenotic lesions like mitral stenosis, or you can get in aortic stenosis, you can get palpitation, but it is less common. So let us revise so it can be in valvular heart disease. How it can occur in coronary heart disease? Coronary heart disease again due to arrhythmia. If there is lack of blood in the coronary arteries, you can get a left ventricular dilatation, and you can get a kind of ischemic dilated cardiomyopathy. DCMP, you can get a dilated cardiomyopathy, ischemic in nature. Ischemic DCMP, which can give rise to arrhythmias. An important feature of cardiomyopathy is arrhythmias. Then you can get in heart blocks. Conduction defects also, you can get palpitation. So we'll talk about conduction defects, which can give rise to palpitations. So conduction defects, how they give rise to palpitation. For example, this is a normal ECG has a P, Q, R and S and a T. It has these complexes. Now P to R, PR interval represents the conduction from the sinus node, then only you get a P. This beat is generated and goes to the ventricle. And the ventricle produces this R wave. Yes, QRS is produced by the ventricular contraction. Now supposing there is a P not conducted, AV block, not conducted to the ventricle, and there is another P now. So another P. So this is second degree heart block. First degree means only prolongation of the PR interval. Prolongation. 0.12, just by the way, you will learn it later, to 0.21 is the 0.12 to 0.21 is the normal PR interval, second. Okay, one small square is 0.04 second. Later on we'll come to that. So if there is a conduction block, then also you can get palpitation, because after these two beats you can get, one may be conducted and you can get a QRS. So again one beat, again missed beat, and then you can get a QRS. So it can have various patterns. 2 beat, 3 beat may be missed, or there may be a complete heart block and you can get cannon waves. A complete heart block means that you get these PPP irrespective of the QRS, and you can get random QRS somewhere. QRS average P rate may be around 70, but QRS rate will be around 45, because it's a complete heart block, no conduction from atrium to ventricle. Ventricle beats at its intrinsic rate of say average 45 to 55. So you can get these random P's and then interspersed with QRS. No relation between P and QRS because QRS is not arising as a consequence of P. It's not coming from the sinus node. Ventricles are beating independently of the atrium. Atrium beating separately from the sinus and AV node is making the ventricles beat. So intermittently these valves opening and closing also will not be coordinated, and therefore you can get, because of this you can get a ventricular systole against a closed valve. Aortic valve may not open and this ventricle may contact and reflect all its pressure back from the mitral valve, and you can get a palpitation. You can also get cannon waves, which you can see in the JVP, because same thing is happening on the right side, and through the superior vena cava blood is going back and it can produce a cannon wave, which you can see in the JVP. Now of course all things you can see in the 2D echo Doppler very clearly. So we don't have to do a physical examination, because whatever physical examination you do, palpation and auscultation, percussion, everything, you may be wrong. But a direct imaging by an echo Doppler machine, direct visualization of the heartbeats, the valves, the structure and function of the valve is definitely more accurate. And so it's always better to put the patient on an echo machine and see everything. And the books are also trying to change and put every correlation with the actual imaging. But now in my method, what I do of coronary revascularization, coronary artery revascularization by extended OMT, non-invasive, painless method with GP2B3A inhibitor, medical lysis of the clots, not mechanical lysis, drug lysis, pharmacological lysis of the clots versus mechanical by stent angioplasty bypass. You also avoid this exposure to dye, radiation and radioactivity. So much of it, thallium scan, technician scan, PET scan, CT scan giving you thousands of times more radiation than even X-ray. X-ray itself is so harmful. So this damages. But ultrasound, echo, very low radiation, hardly any. So these are the safe tests. So you can avoid the toxicity of the dye. Toxicity of the dye is kidney failure. Creatinine increases. It may never come to normal. Even in 40%, it never comes to normal as much as 40%. Creatinine does not come to normal. And so much of dye you have to give to localize the blocks. In my method, I don't localize the blocks. I just make the patient lie down, give this IV infusion, discharge after 24 hours, and you can do a pre-post ECG, 2D echo Doppler, pre and post, and see the structure and function, see the symptom, monitor the symptom. Rest is documented and proved. I used to get angiography done pre and post. I don't get it done because I had many complications of angiography. After doing a safe, non-invasive revascularization, I had complications when I started to see in angiography whether the blocks are remaining or not. The blocks were never found after that. It was totally successful. There are so many trials on it. There are any number, Courage trial and Prism Plus trial, Cadillac trial, so many trials and documented scientifically, multicentric worldwide trials. So I don't do this anymore. No dye, no radiation and no radioactivity, and I don't even get treadmill test done. It's very dangerous. In treadmill, when you are doing a target-directed treadmill test, maximal, submaximal exercise test, you don't know what's the submaximal for that patient. So the patient can get arrhythmia, can get heart block, can get undue tachycardia, can go into heart failure, can get fresh coronary artery blocks, ischemia, can get syncope, and he can get heart failure, breathless, LV failure, and he can die. So patient can die on a treadmill. I've seen deaths occurring on the treadmill. But in gym actually you enjoy and you can do according to your limit, whatever you can. Once you get fatigued, you go off it, you put it off. But in this treadmill, a patient gets scared, he's challenged, and he sees that there's one paramedical or doctor there saying, karo, 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 खूब करो, जितना करोगे, तो he thinks that जितना मैं कर लूँगा, prove कर दूँगा, मेरा हार्ट ठीक है, मेरे हार्ट में प्रॉब्लम नहीं है, I'll be saved from angioplasty, bypass, nothing will be done because I have done so much of treadmill, he'll go on doing. से जितना कर सकते हो करो, और करते करते मैं जान भी दे दूँ पर मैं करके दिखा दूँगा कि मैंने ट्रेडमिल किया. He'll tell everyone मैंने 15 minutes किया, 12 minutes किया, like that he'll tell. So now about palpitation, treatment is according to the etiology and perception of palpitation. It can be anywhere in the precordium, usually epigastrium in functional, but nothing as such. But and you can sometimes see the heartbeat, you can see the apical pulsations, cardiac pulsation, you can see in the pulmonary area, or you can see in the apical area. You may see palpitation, you may see on the left side, right side, sometimes rarely right side of the sternum, or you can see even aortic regurgitation sometimes on the right side also you can see. First aortic area is on the right side. Right second space, left second space, left third is second aortic area. So you may see it anywhere, you may not see, but an ECG can definitely tell you the cause for palpitations. An ECG done during palpitation can tell you the cause, simplest test, and the other further diagnosis by 2D echo Doppler. And otherwise all the other tests are not so useful. So this can tell you, and simply a pulse oximeter, the patient can wear a pulse oximeter and you can know by the pulse oximeter whether tachycardia or bradycardia is there. And in the pulse oximeter you can also see the rhythm, isn't it? In the pulse oximeter you can see the rhythm. By these lines you can see the space between the lines, you can see a small line or wave coming either below or side of pulse oximeter if you see carefully. So you can know about the arrhythmia rhythm also using a pulse oximeter, isn't it? So this was about palpitations. So you must know the etiology, and you must know what is the reason for the palpitations. So that's all about palpitations, and this was about etiology and perception of palpitation. But treatment, I told you, we will go chapter wise about the treatment, and further diagnosis by ECG, recognition of the cause, and echo Doppler will be done in subsequent chapters, so you will understand better. Okay? So any questions on palpitations? No? Hope you liked the class today? Yes. Otherwise you can always interrupt me and ask questions in between also, because if I tell you कि question बाद में पूछना तो बाद में भूल जाओगे तुम लोग questions.